Hello, dear friends. I am Dr. D. Prabhakar from Chennai, and I am attending the LAICON, the Lipid Association of India conference at Pune. And it's a great pleasure to be here with all the lipidologists and lipid luminaries here. I want to give you one good news and bad news. The good news is that the cholesterol, the LDL cholesterol or the bad cholesterol, is 10 milligram lower among Indians. But the bad news is, despite a lower LDL cholesterol, we are 20 times more prone than the Japanese and 4 times more prone than the Americans for heart attacks. That's pretty bad. And what happens is 50% of this happens in people less than 50 years of age. So we need to start early, treat early to prevent this epidemic of heart diseases that is happening in India. What I spoke in this conference was about a small myth, which commonly what we call as statin intolerance. Treating cholesterol is bad, low cholesterol levels are bad. You keep listening to it all over in the social media. Doctors are prone, patients are prone, the public is, everybody wants to say anything that is against what is the conventional norm. So what I spoke was on what is called a statin intolerance. Now what is statin intolerance? Simple, if you are not able to take a cholesterol lowering tablet called the statin to achieve your goal LDL cholesterol, that is statin intolerance. Basically, it is due to what is perceived as adverse effects. Because true statin intolerance is about 5%. But most of the times they think there is a problem because they are prone to suggestions, what we call it as the nocebo effect. You say that you're going to develop headache, 5 people tell you the same day you're going to get a headache. Something similar happens with statins, and that is one of the commonest myths. You must also understand that most of the people think I can bring down my cholesterol very easily. I can do a lifestyle change, diet, exercise. But remember, your diet is going to do only about 20% of cholesterol reduction. 80% of your cholesterol is synthesized within the body, and that is where the statins come in. So it's very important. And it's not that the cholesterol is just a one-point measurement. It's called cumulative loading, wherein over a lifetime, if your total number of cholesterol, let's say you have 200 LDL cholesterol, for 40 years, the load is already 8,000. So you have to be looking at the load of cholesterol, and each month or year, you're adding cholesterol years, which increase the size of your blocks. So that you should remember very carefully. Now, what are the myths about this cholesterol? There are 3 major myths. One is it produces muscle weakness, it produces muscle cramps and all these problems. Now, how much does it happen? It's about 5 to 10%. Most of the time it is possible, but it should be happening within the first 3 months of starting this therapy or increasing the dose. Not after 2 years, not after 3 years. So you have to be very careful there. And most of the time it has to be involving both sides. It has to involve the close-up, the proximal muscles, and it does not produce much of weakness. It can have pain, can be bilateral, symmetrical, and it happens very early. Remember that. But most of the time, any kind of muscle pain, you go to an orthopedician, you go to a general practitioner, everybody says, no, you have joint pain, this could be because of medicine. No, please understand, no. Because if you are having a heart disease and if you stop taking these drugs, there is a 50% higher chance of getting a heart attack. So don't stop these medications, take the drug to the target, that's important. The second problem that people keep talking about is when you bring down the cholesterol with statins, there is higher incidence of diabetes. Yes, it's true, but not in everybody. It is there in a select group of patients who are already prone for diabetes. The obese, body mass index is high, or those whose elevated sugars are just above 100 but less than diabetes. So the pre-diabetic, the borderline people. So what you do, you start the statins and institute lifestyle modifications. Start them on a diet and exercise, the benefits are more. But is there benefit of statins? Clearly, the incidence of new onset diabetes or the newer diabetes is higher, but the benefits are 50 times more. Mind you, it is 50 times more. So when the benefits are so huge, don't deny your patient statins, take the medication and get the benefits. The third important problem that we keep talking about more often is what about neurocognitive? Your brain needs cholesterol for functioning, body needs cholesterol. Please don't worry about it. Locally, there is synthesis of cholesterol within the brain. In fact, there was a large study which was done to show that cholesterol lowering with statins is going to produce dementia and Alzheimer's disease. Now, what happened in that study is what is classically called as reverse causation. They found out that there was a 20% reduction in dementia and a 25% reduction in Alzheimer's disease. So this happened, and the statins have been found to be extremely beneficial in these patients. So what message I want to give to my friends here is that statins are very important medications in the management of cholesterol. And start treating cholesterol early because there is a cumulative loading and don't worry about the myths that people keep telling you over time. It is beneficial, take it. And I should thank Lipidization of India for helping me spread this message. And if you have liked this video, please share it and subscribe to LAI TV. Thank you.